I've covered far more stories in healthcare where I'm shocked the tech isn't there. It's one of the few, if not the only industry in the US that still relies on fax machines and pages. I think only drug dealers, as far as I'm aware, still use this outdated and legacy technology. And I think even they have now moved on.
This season, I've chatted to many experts working to solve healthcare challenges. But one person I'm about to talk to remotely has covered it all. Chrissy Farr is a former journalist and has covered the intersection of healthcare and tech for over a decade, and is now applying her expertise as a venture capitalist. So I'm intrigued to get Chrissy's take on what the future looks like.
Chrissy Farr, it's lovely to chat. What got you into the industry, and looking back on it, what were the big things that jumped out of that at that time?
For me, it was really a personal experience as a patient. When I was a teenager back in London, I had a bit of a, we call it a diagnostic odyssey, where it just took me a really long time to kind of get a diagnosis. And in that time frame, I saw a lot of doctors and I had a lot of experiences with the healthcare system. And when I eventually moved to the US for graduate school, I decided I wanted to really get more informed. There's so much about it in the US that I sort of discovered was fundamentally broken. And that kind of propelled me into a career in covering kind of, lots of stories about healthcare and, trying to figure out sort of what we could do to fix it and what was next. And that eventually led me into an investing role, which has been, the last 2 months of my life.
From your reporting of COVID, how has it irreversibly changed healthcare for good?
COVID has fundamentally changed the US healthcare system. There's just there's no doubt in my mind of that. What we have seen is this incredible acceleration of telemedicine or virtual care. It's, essentially propelled us 5 years into the future in the space of 6 months. It's not, I don't think that it's fully a replacement. There are obviously many things that you still have to do in person. And that relationship between a doctor and patient is so important. Sometimes patients just want to be seen, but there's so many use cases where it makes sense. And I'm seeing all of that kind of be explored now.
There is a moment, obviously, which has been amplified by COVID in terms of the rapid evolution of the requirement for AI and digitization. From a reporter's perspective, how do you think that has shaped your view on where we are with MedTech today?
I think the key is to really think about, the idea of bias, because human beings are biased, and AI built by human beings is also biased. Women, for instance, oftentimes experience kind of heart attacks differently. They might have different symptoms of heart attacks. And if that isn't baked into the algorithms, then you could end up telling a female patient that they're fine and they should stay home, when in fact, what they really should be doing is rushing to the emergency room.
There's a lot of chat, Chrissy, about predictive and preventative healthcare. And I know you've covered personally a lot of that, and you've written a lot about it. I mean, briefly, what is it, and what are the major obstacles that are having to be negotiated in trying to implement it?
Yeah, there's a whole kind of set of thinking that what we have in the US is a sick care system, not a healthcare system. So what we do is we treat people when they already have illnesses that are already fairly evolved. And so now there's a lot of talk about kind of what is the next iteration of our system. And I think it's actually in preventing disease. And you see that, with so many incredible technologies today that are just being developed now. For diagnosing conditions in new ways. With, a smartphone, for instance, you could, there are companies that can look at the way that a person uses their smartphone keys as they call and text, and determine over time if this person is at risk for a depressive episode, just by tracking the way that you use your smartphone. So that's just one example of something that we could do tangibly today to predict a healthcare outcome. You also see that with, the rise of kind of this trend of seniors wanting to age in place in their home. And there's just a ton of work going on now to predict whether somebody is likely to get dementia just by tracking the way that they move around their home environment. I think all of this stuff is so promising. But But what we need to do is figure out a way to pay for it, because the system today isn't exactly set up for it. So that's what we'll be doing in the VC landscape over the next 5 to 10 years, is trying to find those companies and then also make them successful.
Chrissy Farr, thanks for chatting to me today.
Thank you.